And then, you start rebuilding. And everybody talks about that new normal, and you know that it's, I don't know, it's kind of a cliched term, but it is. From the time of your diagnosis, there's that new normal. In the beginning, you think, how can this be happening to me? Well, especially when you look it up on the internet and you see that myeloma is a cancer of average age of 65, men, and more proportionately, statistically, African Americans. So I'm like, how did a white 49-year-old female end up with this? And who knows? There was a few days of sadness. I guess I worried because my kids were all in college. One of my daughter had just graduated college. My other two boys were still in college, and nobody married, no grandchildren. I thought, I'll never see this. I'll never live to see my children get married and have grandchildren, because the prognosis was 3 to 5 years. I asked my oncologist about that because that's, of course, what the internet says, and he says, yeah, he goes, 3 to 5 years is the average, maybe 7. He goes, if you get to 10 years, that would be a home run. So that's kind of bleak when you're 49 years old. But I'm coming up on 10 years this October, and I am fully prepared to give my oncologist a hard time that I hit the home run and still going. But anyways,
yeah.
So I got, and I've always told him that. I said, those numbers are just averages, and I am not average. For every person that got 5 years, there's somebody who got 10 years and somebody who got 1 year. So those are just averages, and I plan on beating the average, and I have so far. And then
and a lot could change in 10 years. It's like,
well, it can. At the time, the only when I was diagnosed, there was Revlimid and Velcade. As far as the new drugs, I mean, there was thalidomide and some other, and Cytoxan and other drugs, but Revlimid and Velcade were the two that people were using. I didn't do Revlimid because of my kidney function at the time. It can be hard on your kidneys. So when I got done with my stem cell transplant and they started talking about maintenance, the only maintenance offered was Revlimid, and everything I had read said Revlimid can be really hard on your kidneys. So after a lot of discussion, research, talk with my husband, talk with my oncologist, we decided not to do maintenance. And I got a very good partial remission, which I have to say I was very disappointed over. I had felt like the fact that I was doing as well as I was doing, I was a little bit of an overachiever. So I was very disappointed not to get a complete remission. But even still, I decided I would go with no maintenance. And I managed to go for 18 months before I saw any numbers start to climb. And then my M spike eventually started to climb.